In the last couple of years, the average age of, for example, a GAA athlete that we've operated on is 26, so half the patients are under 26. The sports would be about 85% of our practice. The majority of those athletes would be from the Gaelic Athletic Association, mainly at club and inter-county level. Quite often we would see patients here in their late 20s, early 30s who have come too late for the preservation surgery, and many of those, even when they give up the sports, will return back 3, 4, 5 years later and would be at the stage where they would need a hip replacement. There's no doubt that when you're dealing with the GAA athletes, they are absolutely dedicated to their sport. It's not only just a sport, they're part of a family. When athletes travel down here from all parts of Ireland, they come with one reason only, and that's to get back playing.
Hopefully I'll be back playing hurling in a couple of months. I'm kind of looking forward to it now because it'll be a relief of pain for me over suffering for the past couple of months. Well, I'm here for my mother was up with you. And yeah.
How are you? You're number 16, alright?
Yeah.
You're over to Mr. Carton's half level, right?
Yeah, it is, yeah.
Perfect. Have you been with us before?
Yeah, I was in this time last year getting my other hip.
Oh, perfect. So you know
I know the score now.
Yeah, talk to me.
When I walked in last time, I thought it's only going to be my right hip. But then, after getting the surgery on my right hip, I realised my left hip. I knew straight away my left hip was feeling tight. So then I knew I'll be coming back in, but I didn't think it'd be this soon. Hello, I'm back. I got me.
Do you want to take a seat there? You won't be too long. It's just with the last patient.
Yeah, okay. No bother.
The vast majority of athletes who attend the clinic would be between the ages of 18 and 30, 32. We performed successful surgery on Evan last year with his right side. He had a very successful outcome from the surgery, was back playing, and unfortunately for Evan developed the same problems, which is not unusual. About 40% of our patients require surgery on the second side. So for Evan, it's come almost a year later. We would very rarely operate on anybody under 16 years of age. At that time, there's still lots of growth potential, and we want to try and have athletes finish the growth potential as much as possible. As you're growing, as you're getting taller, and if you're playing sports, and there's a lot of intensity on the hip joints, especially with changing direction, acceleration, deceleration. This puts a lot of pulling and tension on the ligaments of the hip joint that can change the shape of the growing parts of the hip. Okay, and you just bring the two legs together for me, nice and tight as you can. Any problems there? The two knees up for me. His problem is very much on the edge of the joint where he has quite a prominent rim on the socket, and that's putting pressure on the seal, the labrum of the hip. And during sports, he has abnormal contact between the ball and the socket. And when he's running, the ball is connecting with this abnormal rim of the socket, and it's squeezing the seal inside the labrum, and the labrum eventually tears. And the pain is where?
Right in the groin. Yeah.
Deep in the groin, and that's the pain that you get.
Always have. Always.
When it reaches that type of stage, it's very unlikely that physiotherapy or conservative measures are going to undo that mechanical problem. This is an X-ray of an abnormal growth of bone overlying the front of his hip joint, and this is blocking his hip from coming into flexion. And this is after we've removed this large defect here. So you can see this whole area here is now space for which the hip can now move into very freely. Just bring the knee up and just let the knee fall out towards the side. I'm just going to stabilise the pelvis all the way down from any problems there. And pain again in the groin. Yeah. Okay. We do need to think about the amount of times these players are training, especially if they're playing both GAA football and they're playing hurling. They're training 4 or 5 days a week. The emphasis recently on gym work. All of this puts enormous strain on the hip that's growing. So all of these do need to be looked at, and the way we're training and the way teams are training and the pressure put on some of these young athletes, it can lead to further problems.
12 weeks rehab. It's a lot of work to do, especially with being in school and that. You have to find time to do it, because otherwise I'll be walking with a limp.
Okay, we're just going to turn the lights down now.
Fingers crossed it goes well, but if it comes to the stage that I'll have to get it done again, I'll be asking questions kind of, is the work coming back playing? Which hopefully it won't be. Kind of once I start doing my exercises, I know how my leg is feeling. They went in around there, just to the side of your groin area, and it's only 2 little small keyhole, so that I won't be scarred around really afterwards.
Deja vu, kind of, you know. It's the second one now, so hopefully that's it. You don't want to be coming back in here on a regular basis, but look, Dr. Carton was in earlier. There wasn't as much damage done on the second hip as there was on the first, which is a good thing.
I'd say if I went back playing after getting my right hip done, I would have done more
damage, yeah.
than what was done.
Fingers crossed now, he'll have a full recovery. But he's been up and about already, so the more movement and the weight that goes into the hip, the better now at the moment.
Yeah, but I already did a bit of rehab there. I'm only out about 2 hours, am I?
2 or 3 hours.
Straight into doing rehab already. Like.
So 12 months of rehab, and then decisions have to be made then after that.
Sport comes at a certain price.